Hi everyone, I'm here to talk to you about my business Foot Care by Kaitlin. Foot Care by Kaitlin has been running since 2021. Here we believe knowledge is power, so I hope that you guys learned something and are able to take it back to your daily lives and help somebody you care about. I am a licensed practical nurse. My name's Kaitlin Nielsen. I got my advanced foot care training in 2021. There was a starving need for foot care out here in Stettler, so I decided to open up my own business, and we've been prospering ever since. I am also an OniFix practitioner. OniFix is something we'll discuss about later in the presentation if you don't know what it is. So my passion is especially diabetes. I've been a diabetic since I was 13 years old, and I love helping those with diabetes. I also have a love for helping people with disabilities. I've worked in group homes for a good portion of my life, along with working with those with dementia, and I also enjoy working with wounds as well. This year, when I went on mat leave, I hired Cheryl Saunders, a registered nurse that I've worked with, and she's absolutely fabulous. She's got her advanced foot care training and oversees a lot of the Alex and Bashaw region for me. I would say one of her biggest assets is not only her ability to make you feel very welcome. She's very positive, very funny, but she's also very good with helping those with dementia or those that struggle with letting people touch their feet. So this is a question I brought forward at my presentation in Daysland earlier on in the year in June, and a lot of those individuals there were seniors. So I got a lot of what I expected. A lot of trimming your nails, a lot of painting your nails, and you know, it's a lot more than that. But back when our seniors population was younger, a lot of them told me, hey, it was a luxury to get foot care. We sometimes didn't even have footwear. If we had footwear, it got passed down from sibling to sibling and didn't always fit right. So nowadays, I'm helping these individuals who have been dealing with the repercussions of their feet not being taken care of when they were younger. So let's describe a little bit more about what that looks like. So let's discuss a lot of conditions and things that I see on my clientele's feet. The first one is ingrown nails. Lord, I probably see a good portion of my clientele have ingrown nails from 12 to 98. It is a very common thing that people deal with. I also have lots of bunions, edema. Edema is also known as swelling, thickened nails, fungal nails, and those two really overlap, splitting nails, bunionettes, overlapping toes. You'll see this a lot in individuals with arthritis, wounds, that'll be a big thing we'll discuss later, fallen arches, fissures, also known as cracks. A lot of people get really deep cracks, particularly on their heels, sometimes the tips of their toes, high arches, corns. I find a lot of people don't know much about corns, and they're really mixed up with plantar warts. So that'll be a slide we'll discuss later as well. And calluses. So when people ask me, what kind of people do you help? That's actually a really broad question, because a lot of people think it's seniors and very boxed in. But in reality, I've helped people all the way from 12 to 98 years old in the short span that I've been doing foot care. And a lot of the younger population, I see a lot more of ingrown nails and stuff like that. But everybody's different, and we take each client and make our own individual care plan as they come. So for foot care nurse, we classify as dealing with a lot of people that are high risk. So let's discuss what high risk is classified as. So somebody who has diabetes, like myself, we can be classified as high risk. The reasons for that can be because we're immunocompromised. This makes us at a higher risk for infection. And this is a very broad term. I have met a lot of diabetics that have actually got a really good wound healing and aren't immunocompromised, but we are more prone to as diabetics. Another thing is peripheral neuropathy. So peripheral meaning basically the furthest distance away from your heart. So we see it a lot in hands and feet. I would say primarily, though, we probably see it in our feet. And with neuropathy, a lot of people think numbness, but I can tell you there's a lot more to it. I've seen a lot of different circumstances. So we get that burning, numbness, tingling, but I've also had people tell me it's like walking on spikes. I've had other people tell me they can't even really describe it. It's just that feeling, it's the way they describe it to me. I've had another fellow who said it's like walking on jello. So everybody's a little bit different, and the more we open our minds to what neuropathy can feel like, the more we might realize people have it and we can deal with it earlier. But neuropathy is a diagnosis by your doctor. So as a foot care nurse, if you're not diagnosed, I will call it numbness. So how do we test for numbness in your feet? So we use a monofilament or a sensation test. So this is where we use a little strand of nylon. It's not a needle. A lot of people get really scared. It's a very flexible little piece of nylon there. And I poke on 10 different spots. And you tell me if you can feel it or what it feels like. A lot of people, you'd be surprised. They say, I've got full sensation on my feet, and I do that, and they didn't feel any of the pokes I have. It doesn't mean that your foot is entirely numb, but it does tell me you have numbness in your feet. And usually I say we do this about annually is what most practitioners say. So this is just a forewarning for you guys to skip ahead. If you guys are squeamish at all, we are going to be talking about wounds and also amputation. So feel free to take a couple seconds and move past that if that's something that will bother you. So wounds. As I discussed earlier, I'm actually a home care nurse and I deal a lot with wounds, and I do have a passion for that as well. So 60% of ulcers reoccur within a year. I know that that's really surprising to some people, but that new fresh tissue, it's very fragile. Ulcers, I've had them last for months, I've had them last for years. I've had people that pass away with those ulcers. And these wounds here, they might look graphic to you, but I can tell you I've personally dealt with people with wounds that look pretty much just like this. These are not my clients personally. These are photos that I've gotten off the internet, but I've helped clients with each one of these circumstances. And talking to most of them, they do admit that it's very life-changing getting a wound, particularly on your legs or your feet. It affects your mobility. That affects your ability to exercise, your ability to get around. A lot of people say it's quite painful. So you're either dealing with a lot of pain every day, or maybe you have to take drugs that are prescribed by your physician in order to deal with that pain, which can also affect. So these wounds are definitely nothing to be taken lightly. And this is another reason why it's so important to be checking your feet. The next one is amputation. And the reason why this is right after wounds, which I'm sure a lot of you have caught on to, is if a wound doesn't get healed, it gets infected, goes gangrene, lots of different circumstances, you can actually lead to needing an amputation. And as scary as it is, once you've had one, you're already at a higher risk to get another one. So next we're going to discuss renal disease. Renal is quote unquote known as kidney disease. So once again, it's a lot like the diabetes. We're already immunocompromised, so we're at a higher level for infection or risk. And a lot of them do have trouble with neuropathy. I found that burning, numbness, tingling are just a couple of the sensations. But you'll also find people with kidney disease, they get swelling. And a lot of that is related to that blood flow. Can't get back up your legs, so it just sits there and it pools there. And this is where you can get a lot of wounds too, because a lot of people that I find with swollen legs in particular, it's almost like their skin sometimes is like a sheet of paper. And there's so much fluid out there, it's just doing everything it can to get out. So this is something where I might say, hey, have you talked to your doctor about compression socks? I usually say when you're going through an immense amount of swelling like that, always make sure you talk to your doctor first, because some people aren't made to have compression socks, though a lot of people they do find work really well. So here we go with the swelling again. We've kind of already covered most of this, but higher risk for wounds, like I said, because you're almost like a sheet of paper in my opinion, and that decreased circulation because your valves can't get it back up again. So let's talk about some common structural difficulties that I do find. So bunions, very, very, very common thing that I'll see. This can be genetics, this can be trauma, this can be footwear, a whole load of things. Bunionettes are very much the same thing. They're also known as tailor's bunions, actually, as a side note, because tailors, with the way they used to sit and sew, they actually got these from the way they sat. You'll see a lot of overlapping toes, like we discussed earlier. This is a lot of my people with arthritis, I will see this. It's definitely a very high risk for pressure sores. It off throws your balance. Another one I see quite a bit are claw or hammer toes. These are usually, I find, from too tight of footwear or somebody who wears high heels in particular a lot. But anyway, let's go over the information here. So risk factors, it makes you at risk for pressure areas, which will lead to the possibility of wounds, right? Especially if you're rubbing with shoes or anything like that. And you might also get an increased callousing, right? Because once again, that rubbing can cause friction. It can also cause corns as well, which we'll discuss later. Some of the preventions you can use is proper footwear. You will hear me say that so many times. Proper footwear is so important. Some people do need custom footwear, especially if you get these overlapping toes like this or bunions that stick out. Sometimes you can't find shoes that fit, even if I've had these men that have 13 size feet. Sometimes you can use custom footwear or fedoras. And fedoras are something we'll discuss more at your appointment if you choose to. It's basically like a stretchy fabric shoe, and it's not super cheap and not the most attractive shoe in the world, but they do work really, really well. The last thing is called padding. So padding, there's lots of different types that you can get for different circumstances, but here's 3 that I've outlined that are quite common that I go through. The first one are hammer toe cushions, and I'm sure a lot of you can guess what those are for. A lot of times we use them for hammer toes because they will go and they will raise the toe so they're not putting pressure directly down. And a lot of people, if they have hammer toes, you sometimes find sores on the tip of their toes because they're constantly rubbing on the ground. Usually you walk with your entire toe there. In this way, you're only walking with the tip of your toe when it's a hammer toe or a claw toe. Another thing are toe separators. These are really good for obviously separating your toes, but they can also help straighten bunions. Some people found it makes it a little bit more comfortable. The one thing with toe separators though that people don't think about is as soon as you put pressure on the area over here, I'm just going to circle. That's a terrible circling job. Anyway, you'll start to put pressure over on these toes now that you've got the toe separator over here separating these ones. So just make sure that you're really watching those pressure areas. Also dealing with pressure areas, we've got moleskin. A lot of people put this down if they've got a pressure area because it will rub off the moleskin itself. So a couple side notes that I always bring forward for people with padding is you have to take it off at night. Put it on in the morning, take it off at night. You do not want to leave it on all the time. You have a really high risk of sores because something's always sitting there rubbing. So always, always, always make sure you take it off at night. The other thing is, with hammer toe cushions, sometimes you'll get a fabric hammer toe cushion. And these are good, but I find that the silicone ones you can wash easier. You just use some soap and water, leave them out to dry overnight, and you're ready for the next day. But that's just my opinion. So some common concerns that we run into are fissures, also known as cracks. This is huge. And I don't know if there's any science behind it, but I've run into a lot of women that actually go through this more than men. So possible causes are walking barefoot. All of us walk barefoot. This is why it's so important. You can get those cracks all over your feet. You can also take the chance of getting sores, things like that, especially if there's numbness there. Another thing is called heel stomping, basically meaning you walk and you put your heel down first. You will hear me say I am one of the worst for this, and I really have to adjust my walking in order to not hurt my heels. Another thing is friction, right? Because you're walking around in those shoes and you're going back and forth, back and forth. There's got to be a barrier that builds up there, right? If your shoes do not fit right. So possible treatments, orthotics. A lot of different professionals can make these, anywhere from orthotist, podiatrists, OTs. That's something we can discuss at your appointment. Once again, there's proper fitting footwear, frequent filing, right? So we can get that down while we're trying to figure out the cause or how we can make it better, but also daily application of a thick lotion with urea. And a lot of people tell me, well, why does it have to be thick? Well, you could think of it as thinners like water. You just put it on and it falls off like water, whereas something thick actually stays there. And the urea actually really helps with the dry skin. If I had somebody that had dry, cracked skin like this, I would suggest at least something with 20 plus urea in it. And a lot of the time you have to get that from a pharmacy. So our next thing is corns. So corns are commonly confused with warts. Corns, a lot of people will either say they don't have any pain at all, it doesn't bother them. Usually I don't touch them then. Whereas if you're anything like me, I occasionally get these if I'm walking incorrectly or I have a pair of shoes that doesn't fit. And it'll be described as almost like a sharp nerve pain. As soon as you step down on it, it really, really hurts. And these are usually, like I said, right, caused from that friction and pressure. That's why those calluses and corns work so closely together. And this is where those orthotics can help to make us walk a line properly, proper fitting footwear again. And you'll see Cheryl and I both do two different techniques, but they both work very well. I will actually take a scalpel and remove the little nerve underneath there. It's a very simple procedure. I've had many people say it doesn't hurt. They don't even know I'm doing anything. Whereas Cheryl actually uses a little cylindrical burr, and she'll actually get that little root out of there like that. So let's talk about nails. So fungal nails, one of the biggest things next to ingrown nails that I get people brought forward talking to me about. So people think they don't necessarily need that routine foot care when they get fungal nails, but that's not true. There's no way for these other products to penetrate if you're not keeping up on your foot care. So you can have something like Jubula, which is prescribed by your doctor. I've also found Vicks and tea tree oil have a really high chance of working as well. But the important thing that I can't emphasize enough is you must apply this daily or until the nail grows out. It's not one of those apply every now and again, oh, it didn't work. It is something you have to routinely keep up on and make sure you keep your feet clean. As you can see at the bottom, a fungal infection can actually lead to athlete's foot, which is basically a fungal infection of the skin of the foot. And as many of you might know, you can actually pass it on to your partner because it's really contagious. So fungal infections are very important to keep track of. I've even had people have such bad fungal infections, the actual nail as I was trimming peeled off, so that all they had left was their nail bed. There was absolutely no nail plate at all whatsoever left. So possible preventions for this, pretty simple. Keep nails short and clean, keep your feet dry and clean. And the age-old one that I'm sure all of us grew up hearing, don't wear barefoot in public areas like washrooms or change rooms. So a lot of people, they don't realize that you can just have thick nails. It doesn't mean that they're fungal. So thick nails is very common, especially with people who've had trauma to their nails, poor circulation, or a condition called nail psoriasis. But you can also see them once again when you do have fungal nails. Your nails usually do grow thicker. Next is one that I quite find exciting to take care of, but I guess that's the weird foot care nurse in me. It's called a ram's horn, and no, I'm not even going to try to pronounce that title because I will butcher it completely. But with ram's horns, I do see quite a few of these, and a lot of people think, oh, it's fungal nails. In reality, that's not true. So you'll see them generally start to curve. They'll either go up or to the side, and they'll actually turn with the nail bed. They'll start to turn it. These are very important to take care of though, right? As you can see, it's very easy for you to get pressure areas, for them to bug other toes, for them to really affect your walking. So as for causes, there's no particularly real cause known for them. A lot of people think trauma. Ill-fitting footwear could be a cause, poor foot care, poor circulation, and there's even a possibility that could be genetics, though that hasn't been proven very much. So as for treatment, you can have surgery to get the full nail removed, by what I understand. I've never had clients actually go and get that done. Everybody seems quite happy to just get it filed down, and we can almost make it look just like a normal nail, if not just a little bit thicker. Another side note that I have here at the bottom, though, is people have struggled with fungal infection prior to getting ram's horns. This isn't something, once again, that's necessarily been proven scientifically. It's just something that's been noted by a lot of people. So let's get on to ingrown nails. This is, oh gosh, probably 40% of my clientele from ages 12 to 98 have suffered with ingrown nails. A lot of people remove them on their own. Other people really struggle removing them. So let's discuss what exactly an ingrown nail is, because I found a lot of people don't know. So the nail plate is too big to fit in the nail bed. Therefore, the nail plate starts to curve in order to try to find room to grow. So as for treatment for this, as it can be quite painful for a lot of people, it's either removing the ingrown portion of the nail, which a lot of people do on their own, and I do quite a bit as well. Surgery, which you would have to see a podiatrist for, and also Onifix. And if you guys remember earlier on the presentation, I said that I was an Onifix practitioner. This is where that all comes into play. Onifix is a wonderful treatment that lots of nursing practitioners are using these days. It's one of the leading treatments for ingrown nails. As you can read here, it is a correction system which helps with ingrown, involuted pincer, or splitting nails without the need for surgery or any pain. The way it does this is it helps straighten the nail gradually as it goes up the nail. It should straighten the nail plate. Many people only need to go through probably about one treatment, but others may need to go through 2 or 3 depending on how severe the nail is deformed. I do like to see my clients at about 6 weeks, or at least when the nail's about 2/3 of the way grown, with that Onifix band on there, just to see if we do need to reapply a new Onifix band or if the current one is good enough. Some people do find the ingrown nails do come back at a point, because as we discussed earlier, if you're wearing improper footwear and sometimes just bad genetics, they do come back. We can apply another band and straighten it out, and I've heard that many people can go years without needing another treatment, if at all. So I have a lot of people, especially my seniors, that are really worried about paying for foot care. It's not a cheap service. I can completely honestly agree with you. I do the best I can to keep prices down, but it's not cheap. So let's try to describe some ways that we can help with payment. One of the #1 things, I probably do this for about 80% of my seniors, is Alberta Seniors Benefit. So this covers routine foot care visits at $28 a month. It is so rare, so rare I ever see a client more than once a month. I usually see clients anywhere from 4 to 8 weeks. And the nice thing with the Seniors Benefit is I can directly take a photo of your bill and send it off to Seniors Benefit. So a side note with that, though, is you pay the full amount ahead. So you pay it directly to me, and then I will send the receipt off to the government, and they will give you back the $28 later on. Not everybody that's a senior, though, qualifies for the Alberta Seniors Benefit for foot care, because you actually do need special needs assistance. And that basically means you've got to fit into these thresholds right here. So $29,630 for somebody who's a single senior, and $48,120 or less as a couple. Another one that I've been helping a lot of people with lately is AISH. So the primary thing is talk to your AISH worker. A lot of people are able to get coverage for foot care. And in doing so, you may need a letter from your physician to describe why you need this medical foot care, but you may also need a letter from the practitioner that's doing your feet, saying the frequency of how often you're going to be seen and the cost. I have been known to write letters after I've assessed clients and seen them a couple times. I've even been known to write letters prior to seeing a client to make sure they can get coverage first. I am more than willing to write letters under multiple circumstances, and we can definitely discuss that at your visit. A couple other plans are eligible medical Blue Cross plans, federal plans. These cover RCMP, veterans, military personnel, and also refugee plans. I do have quite a few people that go through Blue Cross. I've had people covered anywhere from 50% to 100%, and with the way their system works, I can actually punch in and find out exactly how much you will owe me, and they will send the money back to me for any portion that they're going to pay for. I do have a couple veterans. I don't have anybody that's on for refugees, though I am open to the idea. So I'm going to make a quick disclaimer here. So the difference between being a provider and on the medical provider list. So being a provider means I can personally direct bill your insurance company. Whereas being on the medical provider list for places like Canada Life, Green Shield, Manulife, and Sun Life, you will have to bill them. But I am an approved provider for them, which means you should be able to click on your provider list and find my name underneath there quick and easily. So I appreciate you guys continuing to listen forth here. I've done a little slide though here because I know that it's been a lot of information for you guys to take in. But some basic tips for keeping your feet happy and healthy, doing routine foot care assessments, and doing foot care, whether that's by you or a medical professional. Also wearing proper fitting footwear, right? I cannot say that enough, right? Proper fitting footwear will help you so much. And a way to ensure you get proper fitting footwear is by doing a foot tracing. And this is something you can look up on Google and they'll walk you through. It's very, very easily. You can also go to a store that still sells footwear in particular. They'll help you find a proper fitting pair of shoes. Lastly will be for my diabetics or my sensation impaired. So these are my people that are of kidney disease, quadriplegic, paraplegic, MS, spinal injury. These are the people I want you to be checking your feet daily. I've had people that have walked around, as scary as it is, with staples in their feet for 3 days. They had no idea. I've had other people walk around with a rock in their shoe for I don't even know how long, and they end up getting a wound. Another thing is check water temperatures before placing your feet in there. You know, use your elbow, check with your thermometer, because it's very easy for you to scald your feet if you don't have proper sensation. Also, making sure we go back to testing your sensation annually, whether that's by, say, your foot care nurse or another medical professional that's qualified. Another side note that I forgot to mention earlier on in the presentation is some people can have sensation impairment if they've got a low B12. So some people, I will ask them to go talk to their doctor and see if maybe they have a low B12, because that is one of the only ways that I personally am aware that you can get your sensation back from neuropathy at times. My last point here is for our diabetics like myself, manage your blood sugars and A1C. People are drilling this into you constantly. It's very important. Managing those blood sugars can help with so many things, including delaying, hopefully, the effects of neuropathy. So if you or a loved one are looking to book with either Cheryl or I, we would love to meet you. We've got clinic locations in Alex, Bashaw, Big Valley, Daysland, and Stettler. We also do mobile visits to homes in Stettler and surrounding areas, including Flagstaff County. We do cover quite a vast area. So if you're curious on how to book, you can use the information here. You can either call or text the number provided or send me an email. I usually do try to get back to you within a day. You can either visit us on Facebook or use our website as well. We do try to keep the clinics up to date on what day we're having and where and what times are available. But if you can't find that information on there, feel free, once again, shoot me a call, a text, or an email, and I'll tell you directly from there. But if you're looking to book in Daysland, it is a little different. I do work through the Home of Wellbeing out there, and they ask that we book through them. So you will call the number directly shown on the screen, or you can also book online. Very easy system they have there. So once again, thank you guys so much for listening to this. I greatly appreciate it. I hope you learned something that you can take away to help yourself or a loved one. If you have any questions, feel free to contact me. Like I said at the beginning of the presentation, Cheryl and I strongly believe that knowledge is power, and we want to give you that knowledge so you can live the best life that you can. Thanks for listening.